This is my professional testimony YouTube presentation regarding my topic, which is the ever-changing United States healthcare system and my personal stance on the subject. Currently, the United States healthcare system is ever-changing and it's constantly going to be doing so. But telehealth is a more modern approach to the United States healthcare system because it helps to reduce cost of healthcare, and it also is much more accessible, especially to patients who live in rural areas. Telehealth is much more inclusive and helps to kind of break down the boundaries that modern healthcare has formed. So this is just a photo here of what telehealth would look like. It can definitely reduce the amount of patients that are going to the ER when maybe they could be receiving care via their phone or tablet, and then for patients who live in rural areas, especially the elderly population who aren't able to make it to maybe the ER or their physician's office, this is definitely a great option for them, and definitely much less costly, as you can do it just via the computer, your phone, tablet. So the problem at hand with this topic is that, of course, the healthcare system is going to be constantly changing, but I think that we need to become and start thinking about being more adaptable to modern technologies. Of course, we use our phone all the time for, social apps and things like that, but how is healthcare adapting to that? That's what we need to be thinking about. I know at the hospital that I work at, they have telehealth capabilities for pediatrics and obstetrics, where they can kind of connect with physicians up at Nemours, in Wilmington and AI, things like that, so they can get professional advice from physicians when they aren't able to get patients there as quickly. But it's also great as well for just small things that are taking up a lot of our beds in hospitals, a lot of our ER beds, and instead of patients, going to the ER, they can instead use telehealth. So this is also, what I was discussing about. One of the problems is just rural homes and patients not being accessible to the healthcare that they need. So here we see someone just using their phone and being able to get healthcare advice, and there's a lot of discussion on could a patient just say, these are my symptoms, and maybe get a prescription or get some advice whether or not they maybe need to seek further medical care, or maybe it can just be treated via telehealth. Summary of the topic. So I kind of touched on this, and just to speak on it further, so the United States healthcare system, we want to, break down these boundaries. One of the most recent changes was the Patient Protection and Affordable Care Act, which is also known as Obamacare, and that was definitely a big change to our healthcare system. However, using telehealth would be much more innovative towards medical care delivery, and it would definitely lower costs. You would need, less employer costs and less ER bills, which can be highly expensive, and oftentimes patients are going to the wrong place for that. They should be going to, a walk-in clinic, and making sure that patients are educated on where to go, so we're not filling up beds with needs that can be met elsewhere. So the impact on healthcare delivery, and I'll speak on this in a little while on different statistics that we have on telehealth, but the impact would be, of course, lessen costs for patients. It'd be much more efficient, and then there's a speaker that I'll talk about, keynote speaker Susan Detzner, who's speaking about even if we had telehealth capabilities in our ER bays, just the quick in and out area right in the front, if we could have telehealth set up maybe in the future right in the ER bays, and patients could go in and speak with physicians via a computer or a television screen, things like that. But the impact, if healthcare begins to continue to modernize in this way, I think would be great. for the efficiency of healthcare, and I don't think in any way that it will reduce the overall quality of the care that's being delivered. So current telehealth policy, there is policy being put into place, let's see here, for telehealth. I have that here. So one of the most recent policies that I found in my research was the Support for Patients and Communities Act, which is a law that is working to eliminate Medicare restrictions that are based on rural areas, an originating site for telehealth services, so they can provide care to individuals who may live in non-accessible areas. So here's the keynote speaker I was talking to you about, Susan Detzner, and she has a lot of, she speaks a lot on policy, healthcare policy, and how we can continue to modernize the healthcare that we're providing. But Susan Detzner speaks a lot on inclusivity in healthcare. She spoke at the Healthcare Financial Management Association, and she is known as a leading expert in healthcare and policy. She believes that the United States healthcare system needs to make a major change toward the integration of technology in our hospitals and our healthcare facilities. And in order to do so, she has a lot of ideas that I was reading about. And she said that it's not really, healthcare is mostly about, laying on the hands, but also can we have someone who is using telehealth and says, these are my symptoms, and they say, well, say they had an issue with their leg, the patient shows their leg or whatever it may be, and then the physician may say, okay, this is what I think you need, or, you do need to seek out, your local walk-in clinic, or maybe even, directing them to the ER. But doing so can definitely reduce the amount of patients who are going to the wrong place. My position on this topic is that telehealth is definitely very innovative, and I do see this progressing into something that will be normalized in years to come. I can see how beneficial it would be to have, your phone, and instead of, say, you have the common cold, things like that, instead of, going even to the walk-in, maybe saying, these are my symptoms, where do you think I need to go? Can I be treated right here and now? Or for the elderly population, this is huge because they may not be able to make it to the walk-in clinic or to the ER as easily as the younger population can. So I'm going to touch a little bit on supporting data that really shows why this topic is as important as it is for healthcare policy. So the telehealth market, so size, penetration, and potential employer cost savings, there's a lot for each of those areas. The total addressable market for non-emergency telemedicine visits in the United States is 400 plus million people who could have their needs met, projectedly so, through telehealth. And then approximately 1/3 of the 1.25 billion annual U.S. ambulatory care visits can be met via the statistic through telehealth usage. And then I just have my source here from where I got that. But this website, First Stop Health, has a lot of telehealth statistics about telemedicine. This is the one I just spoke about, but a couple other that I circled here that I thought were important to speak on would be this one right here, so right sizing care. It says, over the next decade, the aging American population is expected to place increased demands on the U.S. healthcare system. For older Americans, a review of medical records found that 38% of doctor's visits, to include 27% of emergency room ER visits, could have been replaced with telemedicine. And then we're talking about savings. Healthcare is a huge money issue, and the cost of healthcare is only going to increase. But how can we decrease this? And that's telehealth. So for employers, there's a potential annual employer saving. In a 2014 study, Towers Watson concluded that telehealth had the potential to generate $6 billion in annual healthcare cost savings for U.S. employers. It's $6 billion that we can save through the implementation of this. And you know, nowadays everyone has a phone. A lot of elderly people have tablets. So this is something that, if done correctly, maybe there's a website that they can go to, but over the coming years, something that we can definitely integrate into the known healthcare for society. And then high patient satisfaction. There is some argument, are they going to receive the same level of care through telehealth? And in a 2016 survey funded by the NIH, 3,000 patient responses were analyzed from a CVS Minute clinic, and they concluded that 94 to 99% were very, very satisfied with telehealth. It's definitely convenient, and I think the population that we live in today definitely likes convenience. So this is giving them what they want here. And it showed a third of the respondents preferred the telehealth experience to maybe a walk-in clinic or an in-office doctor visit. And then the last little thing I want to touch on is equivalent quality of care, which is what I was saying a little bit ago. And it shows that according to the American Telemedicine Association, studies have consistently shown that the quality of healthcare services delivered via telemedicine is as good as those given in traditional in-person consultations. And I think the thing to hit on there is that if they aren't able to meet it through the telehealth, they can always direct the patient, maybe even in the future be able to set up services to get transportation for the elderly if they do need to come in and be seen further. But telehealth is definitely, I think, an up-and-coming change for healthcare. It's already being integrated in lots of areas, and a big website to go to with any questions about telehealth is actually just telehealth.com. It's telehealth services, and they have all kinds of information, researched things on this website talking about how telehealth is making great strides for the healthcare community. But I think through speakers and people who are advocating for this change, I think that this is something that we could see in the near future. Thank you.